Hypertension. Hypertension is defined as a systolic blood pressure greater than 140 mm of mercury and diastolic pressure greater than 90 mmHg based on the average of two or more current blood pressure measurements taken during two or more contacts with a healthcare provider. The higher either the systolic or diastolic pressure, the greater the risk. Primary hypertension. Primary hypertension meaning that the reason for the elevation in blood pressure cannot be identified. Secondary hypertension is the term used to signify blood pressure from an identified cause. Hypertension often accompanies risk factors for atherosclerotic heart disease such as dyslipidemia, abnormal blood fat levels, and diabetes mellitus. Cigarette smoking does not cause high blood pressure. However, if a person with hypertension smokes, his or her risk of dying from heart disease or related disorders increases significantly. As a risk factor, hypertension contributes to the rate at which atherosclerotic plaque accumulates within arterial walls. As a disease, hypertension is a major contributor to death from cardiac, renal, and peripheral vascular disease. There are three types: primary hypertension, secondary hypertension, and rebound hypertension. Primary hypertension, also called essential hypertension, denotes high blood pressure from an unidentified cause. Rebound hypertension, pressure that is controlled with therapy and that becomes uncontrolled, abnormally high with the discontinuation of therapy. Secondary hypertension, high blood pressure from an identified cause such as renal disease. Pathophysiology. Although the precise cause for most cases of hypertension cannot be identified, it is understood that hypertension is a multifactorial condition. Because hypertension is a sign, it is most likely to have many causes. First one, increased sympathetic nervous system activity related to dysfunction of the autonomic nervous system. Second, increased renal reabsorption of sodium chloride and water related to a genetic variation in the pathways by which the kidneys handle sodium. Third, increased activity of the renin-angiotensin-aldosterone system resulting in expansion of extracellular fluid volume and increased systemic vascular resistance. Fourth, decreased vasodilation of the arterioles related to dysfunction of the vascular endothelium. Fifth, resistance to insulin action, which may be a common factor linking hypertension, type 2 diabetes mellitus, hypertriglyceridemia, obesity, and glucose intolerance. Identifiable causes of hypertension: sleep apnea, drug-induced or related causes, chronic kidney disease, primary aldosteronism, renovascular disease, chronic steroid therapy and Cushing's syndrome, pheochromocytoma, coarctation of the aorta, thyroid or parathyroid disease. Clinical manifestations: physical examination may reveal no abnormalities other than high blood pressure. Occasionally, retinal changes such as hemorrhages, exudates, fluid accumulation, and arteriolar narrowing, and cotton wool spots, that is small infarctions occur. In severe hypertension, papilledema, swelling of the optic disc, may be seen. People with hypertension can be asymptomatic and remain for so many years. Assessment and diagnostic evaluation. Although a thorough health history, physical examination are performed and the retinas are examined, Laboratory studies are performed to assess possible target organ damage. Routine laboratory tests include urinalysis, blood chemistry. Example, analysis of sodium, potassium, creatinine, fasting glucose, and total and high density lipoprotein (HDL), cholesterol levels, and 12-lead ECG. Left ventricular hypertrophy can be assessed by echocardiography. Renal damage may be suggested to by elevations in blood urea nitrogen and creatinine levels, or by microalbuminuria or macroalbuminuria. Additional studies such as creatinine clearance, renin level, urine test, and 24-hour urine protein may be performed. Medical management. The goal of hypertension treatment is to prevent death and complications by achieving and maintaining the arterial blood pressure at 140 by 90 mmHg or lower. Pharmacologic therapy. Recommended initial medications include diuretics, beta blockers, or both. Patients are first given low doses of medication. If blood pressure does not fall to less than 140 by 90 mmHg, the dose is increased gradually, and additional medications are included as necessary to achieve control. When the blood pressure has been less than 140/90 mm of mercury for at least 1 year, gradual reduction of the types and doses of medication is recommended. To promote compliance, clinicians try to prescribe the simplest treatment schedule possible, ideally 1 pill each day. The medications used to maintain blood pressure within normal ranges by the simplest and safest means possible, with the fewest side effects for each individual patient. The medications are diuretics and related drugs. Example, thiazide diuretics, indapamide, that is lozol. Loop diuretics, example, furosemide, Lasix. Potassium sparing diuretics, example, aldosterone receptor blockers, that is spironolactone, aldactone. Central alpha agonists and other centrally acting medications, example, methyl dopaldomate, tiserpin, serpacil, TESERPINA, tiserpin, serpacil, SERPACIL, serpacil. Beta blockers, atenolol, tenormin, metoprolol, lopressor, propranolol, indirol. Beta blockers with intrinsic sympathomimetic activity, acebutolol and pindolol. Acebutolol, ACEBUTOLOL, acebutolol. Pindolol, PINDOLOL. Alpha blockers, prazosin hydrochloride, that is minipras. Combined alpha and beta blockers, example, carvedilol, 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 labetalol hydrochloride. And vasodilators, example, hydralazine hydrochloride, aprisolin, minoxidil, and sodium nitroprusside, nipride, nitropras, nitroglycerin, tridil, and dioxide, that is hyperstat. Diazoxide, DIAZOXIDE, diazoxide. Antagonist converting enzyme, ACE inhibitors are, example, captopril, enalapril, quinapril, QUINAPRIL, quinapril. Angiotensin II antagonist, example, candacertan, CANDESARTAN, candacertan. Calcium channel blockers, example, diltiazem hydrochloride, diltiazem long acting, And verapamil immediate release, verapamil long acting, verapamil core. Dihydropyridamide, amlodipine, nifedipine long acting. And lifestyle modifications, weight reduction, adapt dash diet eating plan, that is dietary approaches to stop hypertension diet. It includes grains and grain products, vegetables, fruits, low fat or fat free dairy foods, meat, fish and poultry, nuts, seeds and dry beans. Dietary sodium reduction, physical activity, moderation of alcohol consumption. Thank you.